definitely that opportunity is there. So that someone comes in, they have a prescription for gonorrhea treatment or syphilis. I can now have that conversation. I can let them know, do you realize that you are now in a risk group that has a higher chance of contracting the virus due to the fact that you have a sexually transmitted infection? So that makes that conversation really easy. Like that's like the opener, right? So
Mhm.
once you do that, you have the conversation with the patient. And then I think that's the opportunity to educate about post-exposure and pre-exposure. And something that I want to make sure, because I'm going to get this message across, whether the internet works or not, between post-exposure and pre-exposure, that we need as medical providers and also the community, we need to educate them so they can do a smooth transition from post-exposure to pre-exposure prophylaxis. Because there's a lot of the times there's people in the community that come into your office 4 to 5, 6 times a year for post-exposure. And there's no reason that should happen when you have pre-exposure prophylaxis, right?
Mhm.
So on day 25 of the regimen, I want every provider schedule that appointment for prep so that we can do that smooth transition and allow the patient to, empower them to prevent HIV, right? But we know condoms work, right? Internal, external condoms, those are both effective, but we realize that people are not using them. So you have prep on board to ensure that at least you have protection for that HIV piece, right? It doesn't prevent sexually transmitted infections, doesn't prevent pregnancies. That's a lot of the times people have that question. It's only on